You guys, we are back again, and this is very serious. This virus, man, it is worse than HIV. It is taking people out of here. You see, this man, he passed away because of this new virus, HANTAVIRUS, the rat virus. They said it can be passed on from human to human and rat to human. If it's get into rats, you know it can get into bats, it can get into birds. If it transfer from rat to human, it can transfer to rat to cat. It can transfer to cat to dog. It can transfer to different species. It's not limited to rat to human or to human to human. And people are saying it's low, human to human. If it's so low, then why are people dying from it? Okay. So, and they are saying this is a different strand here. All right. So we have to be watchful and know what's going on here. I got a video and people are speaking about it from multiple sources and it's some new updates that you guys need to hear. I want to let you guys know. Thank you guys for joining me at the Deep NOIR News. I am your host, Gigi Medici, and I will not let you down. All right. So without further ado, take it.
Hantavirus here is what you hear over and over again. Hantavirus can't be spread person to person. It's very rare. Bullshit. The particular strain on this boat, the Andes strain, yeah, it spreads human to human. It's been spreading human to human. Out of 8 reported cases, there have been 3 deaths. An absolutely deadly virus. Here's the good news. You can stop this thing if you try. Here's why. COVID. When you had COVID, you could have it for weeks and not know. And while you didn't know, you could spread it. Hantavirus is different. It really only spreads when the person is showing symptoms. And so you could monitor symptoms, quarantine individuals, and stop the spread. Typical rates, COVID, one person would spread it to 2 to 4 people. Hantavirus, really one person spreads it to at most one person. But if you put in actual quarantine practices, you could lower the transmission rate significantly because you know who spread.
I have to say something about this because they're saying the only way you can get it if you are close to someone else. You guys are at clubs together. You guys sweat amongst each other for hours and you guys are close. You guys sleep around with each other. You guys sleep around with each other. You hop to pillow to post. That's why HIV is up. That's why in Atlanta and Houston, all the others, you guys are in fellowship together. You guys go to church together. You guys do a lot of things together. Humans are social. It's just like if in the rats. So the disease is here in America and it's spreading in different countries. You don't think the rats are going to socialize amongst each other? Rats and mice is going to socialize amongst each other, and I hope it if it gets to New York, it's over. Because how many rats they got that socialize, and then that rat is living amongst humans, and that disease gonna get to these humans. It can get to homeless people. Homeless people is walking past other humans, and they get it as well. And before you know it, okay, you got it. All right, so let's go. I understand people being hopeful, but let's be honest. Let's be truthful. All right, let's get the likes up too.
Spreading it. Guess where our resources are in this country? Guess where our resources are to do work? Now, here's the good news. The good news is the World Cup is coming to the United States of America, which means we're going to have the greatest super spreader event for this deadly virus. 3 out of 8 deaths. Are you me? The CDC disbanded the cruise ship infection unit. Are you me? They are lying to you about.
Nebraska will make sure you're comfortable. There's lots of information coming out in regard to the hantavirus news. First, we're going to discuss the 45-day quarantine in Nebraska. Now, the second thing we're going to discuss is the identity of patient 0. And lastly, we're going to talk about that hantavirus outbreak in 2018 in Argentina. Now, the World Health Organization is using this subset of data in order to be able to determine and track what's going on in 2026. Now, the World Health Organization has identified 17 individuals who are on the MV Honduras, however you pronounce that ship, and they are being transported back to the United States, but they will not be let out to the general public. They're actually going to be held in quarantine in Nebraska for 45 days. Now, this is according to UNCM, that hospital in Nebraska, and according to Al Jazeera, they said that the U.S. health officials are making plans for those repatriated 17 Americans. But again, they're not going to be let out to the general public. They will be held in a quarantine facility in Nebraska. Now, next, the World Health Organization has also identified patient zero, the individual who was first in contact with the Andes hantavirus. His name is Leo Skiperoid. Now, Leo is an ornithologist. He is somebody who watches and documents birds. And as you guys heard, they stated that he was somewhere near a landfill watching a specific bird in Argentina. According to published reports, they stated that he had arrived to that landfill on March 27th, started feeling symptoms around April 1st, and then subsequently passed away about 4 or 5 days later. Now, his wife passes away on April 24th, and then a third patient dies on April 26th. That is the timeline. And finally, let's discuss that party in 2018 where 34 individuals were diagnosed with the Hanta Andes virus, and subsequently 11 of them had passed away. Now, the reason why that party is important is because one, we get to finally see studies of human to human contact, and two, we get to understand how it is transferred through air droplets, or at least we're studying at the time. They were studying how it was transferred through air droplets. Because prior to this party, it was just determined that you had to be in very close quarters in contact with the person who was infected in order for you to get it. But this party essentially just broke through that entire barrier because they said, well, if 11 people had subsequently passed away, then it has to be air droplets versus direct human to human contact in close quarters. Now, this graphic is very important because it shows you patient one. Patient one is the one who came to the birthday party with the Andes virus. And you can see how they track patient one to all the different patients. By the time it got to patients 2, 3, 4, 5, and 6, they had transmitted it to patient 10 without patient 10 even coming in contact with patient 1. And again for patient 8, all the way to patient 28, which is rather crazy. Now, patient 1 stated all they said was hello to patient 4. They don't know how close in proximity they were talking because, sometimes people like to talk close, but that was enough to get them infected. And what's even more crazy is that patient 28 and patient 8, patient 28 and patient 8 were not even in close contact with one another, but it was reported that patient.
I gotta say something. Okay, if someone is infected, Michael is infected, he is a walking disease, a walking virus. That means that when he breathes in and breathes out, when he breathes out, he's pushing out his virus, the virus in his body. Each person have fumes, all right? Can you imagine, when you have a hot iron and you see the steams coming out? Well, in humans, we don't see the steams. We don't got that good vision, but there are steams coming out of when you talk, when you breathe out, you are pushing out that infection. You are a walking virus. You are a walking infection. So if someone is close to you and you're breathing their air, then you're going to get it. That's it. That's all. So it is airborne.
8 wasn't using their mask or their respiratory incorrectly, which contributed it to patient 28's exposure. So even wearing your mask incorrectly can get you exposed. Now, if there's any other updates in regard to the Hunter's virus or anything else that I find, I'm going to keep you guys posted. But in the meantime, please wear a mask.
Released the health alert that I said hadn't gone out. A lot of people called me a fearmonger yesterday, but 9 Americans across 6 states are now being monitored. New Jersey, where I live, announced 2 of theirs yesterday, exposed not on the boat, but on a plane afterward. I'm an ER doctor, and I'm a former public health chief physician. Here's what the alert actually says. It calls for airborne.
Wow. So the passenger that was infected, clearly you have to be infected if you're passing it to someone else. They did not know they were infected. They were on the plane, and 2 other people got it on the plane just by being around, just by sitting next to or walking past. Everybody's immune system is different. Some are weaker than others. Some are more accepting of different viruses than other. We are all not equal, you know. So they got it, you know. So that's sad to hear.
And contact precautions, an N95, a negative pressure room. The CDC wants us to treat this like measles, not like COVID. The viral special pathogens branch is running the show, a great team, the same team that handles Ebola. It's a level 3 response, the lowest tier, which shows that they're watching, not panicking. This is the system finally doing its job, the job it's supposed to do. It's late, but it's happening. If you work in healthcare, the Han is in your inbox. Read it now. Read it before your next shift. At 9:45 p.m. last night Pacific time, the CDC
continuing to just come in, roll into the Don Lemon Show newsroom. This is straight from New Jersey Governor Mikey Sherrill, okay? The New Jersey Department of Health has been notified by the CDC that 2 New Jersey residents were potentially exposed to a person infected with the hantavirus after that individual departed from the cruise ship MV Honduis. The residents were not passengers on the ship, and the potential exposure occurred during air travel abroad. So that means there are probably others who are exposed, or there are others who are on that airplane. Both individuals are being monitored in coordination with local health officials and are not currently showing symptoms. The risk to the public, they say.
Of course. One, when people catch a virus, they think it's a regular cold. They're not going to go to the doctor. Two, people are in denial. When people catch something, no, I don't got it. Just like with HIV or anything else, you know how many people that got HIV and they don't go get checked out? We don't know. So the only stats we know are people that have went to the doctor, but it's plenty of these individuals that will not ever go to the doctor, and they're going to pray about it, and they're going to be around other people like a cold or a flu, and they're going to pass it on like the cold or the flu. It's common sense, folks. It's common sense.
Remains very low. No confirmed cases of hantavirus in New Jersey so far. And like the governor said in her release, they're going to continue to keep residents informed as these situations develop, and we will continue to do it here as well. For more information, in depth, make sure you click on to the Don Lemon Show on YouTube, on Substack, on Twitch.
So 17 individuals who may or may not have hantavirus are coming home. And just like that, we're one step closer to a global pandemic. And yes, this is breaking news. So according to ABC News, CDC officials stated that they would not be quarantining the 17 Americans who are headed back to America. Now, the key takeaway is that on a call this morning with officials at the CDC, they stated that there is no mandatory quarantine, which is crazy. Now, according to officials, I am so mad. They stated that these 17 passengers have the option to go home and watch for potential symptoms for 42 days while staying in touch with their state and local health departments. That's it. That's all they got to do. They can just mosey about with the rest of us. Now, mind you, the hantavirus takes 1 to 8 weeks for these symptoms and more to appear. And you're going to just allow these people to just opt in, whether they want to quarantine themselves or not, for 42 days. You saw how the lab.
They're doing this on purpose, you guys. They're doing this on purpose. They're going about it like it's nothing wrong. This is purposely done. This is coordinated. Trust me. They don't want you to worry about it because they want you to catch it. How can you catch it if you concerned and you panic about it? No, 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 no. Everything is horrible right now, to the stock market, to the economy. Everything is horrible. They don't want you to worry because they don't want it to go even more worse, okay? But if you care about your life, if you don't want to die like them other people died, all that stuff, you need to be concerned, okay? Let's go.
Last global pandemic occurred when people had the option to quarantine. You saw how that occurred. I just can't believe this. I can't believe we just reported that they were going to be quarantined for 45 days. And this morning, CDC officials said, nope, we're not quarantining anybody. That was his exact words. No, we're not quarantining anybody. This is crazy. Again, mask up. I don't know what else to tell you. I already told you guys this 3 days ago. There is no funding. They don't care. And if you're not preparing yourself for a global pandemic, you should right now. They canceled the quarantine. So 17 individuals who may or may not have hantavirus are coming home.
And any
Outbreak is expected to arrive in the Canary Islands. All the passengers will then be evacuated to their home countries, including 17 Americans. CBS's Ramy Inocencio is at the port city of Tenerife. Ramy.
Good evening, Jerika. The Hondius is scheduled to arrive, officials say, sometime between 4 and 6 a.m. tomorrow morning. It won't dock, but it will anchor just off the port here of Grenadilla. Small boats and health workers will quickly ferry small groups of passengers to shore, everyone wearing masks and PPE. They'll then board buses and head straight to the airport just about 10 minutes away. Now, that fast processing could help calm the fears of some residents here who have been holding protests, some telling us that they're afraid this is the start of a second pandemic, even though health experts have been stressing over and over that this is not. For those 17 American passengers, once they're at the airport, they'll board a charter plane that's now flying in from Nebraska. It'll then fly back to Nebraska, and everyone will be put into isolation at the National Quarantine Unit. At this point, no one said how long they'll be there, but the incubation period for hantavirus stretches anywhere from 1 to 8 weeks. Jerika, we will see how this all plays out in just a few hours.
Ramy Inocencio, thank you. In just hours, the cruise ship at the center of a
who patient zero is for the recent spread of the hantavirus, but investigators are now questioning ground zero. This was 70-year-old Leo Shipperud. He was an ornithologist. If you don't know what that means, they study birds. They study every aspect of birds. And if you'll remember, investigators were saying that this was likely picked up in Argentina when Leo and his wife Miriam were doing some bird watching and then also visited a landfill. Now, if you're wondering why they visited a landfill, there is apparently a specific type of bird that feeds on rodent droppings that are always at landfills. Let's back up again about ground zero. Originally, it's been thought of that ground zero was this area where Leo and his wife went bird watching. However, the apparent type of rat, the Calilargo rat, which carries the virus, is not in that area. They were in northern Patagonia 25 to 30 days before coming. They're now saying this is almost certainly where they contracted the illness. They arrived March 29th for this ship. So they only had 2 full days before boarding the ship, and the incubation period is at least a week. And remember, it goes up to 45 days. So the problem herein lies now that there would appear to be a whole different set of contact cases that now need to also be investigated. Also, just to reiterate, the ship will be docking Sunday in Tenerife. It has since come out that everybody that is repatriated to their countries will be quarantined up to 45 days. We now know who patient zero is for the recent spread of the